The first thing to say about for BRCA carriers is that really it is something that at some point in your life you really need to be doing. The evidence is quite clear that it reduces your chance of dying from an ovarian cancer if you have the surgery. Sadly, if you're a BRCA1 carrier, your risk may be of the order of 1 in 2 in your lifetime, and for BRCA2 maybe of the order of 1 in 4, ballpark figures. So these are really extremely high risks, and unfortunately, as many of you are aware, ovarian cancer can be very difficult to treat successfully. It's really not a pleasant disease to get, and anything you can do to prevent that is the right thing. But the only thing that's proven to work beyond doubt is removal of the tubes and ovaries. Now that's not such a big decision if you're postmenopausal perhaps, but if you're premenopausal, you maybe haven't completed your family, or you are not willing to take hormone replacement therapy for whatever reason, possibly you're medically not allowed to because you've had a hormone sensitive breast cancer in the past, then it's a big decision to have your tubes and ovaries removed before the age of 51 or so, which is the average age of menopause. So the general guidance at the moment is for BRCA1 carrier, we would recommend you consider having the surgery after the age of 35, and for BRCA2 carrier after the age of 40. We would modify those years down a bit, those ages down a bit, if there'd been a particularly early onset ovarian cancer in your family. Not early onset breast cancers. I'm glad to say the age of the breast cancers in your family has no impact on the age at which someone in your family might get an ovarian cancer. But if, for example, you are a BRCA1 carrier and you have an aunt who had ovarian cancer, say at the age of 39, which would be very unusual, but does occasionally happen in BRCA1 carriers, then we would actually be willing to offer you the surgery from 5 years before that age, so from the age of 34 onwards. Just on the principle, it's a common sense principle that if there's one early onset, really early onset ovarian cancer in your family, maybe there's something different about your family in particular. Either you've got a shared environmental background to the woman in your family who got ovarian cancer early, or maybe you've got other genetic factors other than just your BRCA mutation that are making that BRCA mutation cause cancers of the ovary at a really early age. We don't know. It's a common sense decision, but it does mean that for women with that kind of a family history, our advice may be a little more, you need to be going through surgery now, rather than, your chances of getting cancer in the next year or two is so low, it would be absolutely fine for you to delay the surgery by another year or two. You'd be taking a very low risk if you did that. That advice might be different. So that's why it's so important to get details about your family history, the ages at which the women got cancer, if possible, and certainly death certificate proof of that particular diagnosis. The cancer genetics teams are primed to help you get that information, but you can go onto the government website and pay about, I think it's £11 or so for a copy of a death certificate on your relative, which at least gets the ball rolling in terms of proving the diagnosis, even if the age isn't necessarily the age at which they got the cancer. And I should point that out, it's the age at which they get the cancer rather than the age of death if they're unfortunate enough to have died from their cancer.